Hello.
Hi.
How are you?
Good.
I'm Erin. I'm the nurse practitioner.
I'm Nikki. Nice to meet you.
Nice to meet you too. Is this your first time here, Nikki?
Yes, it is.
Okay. And what brings you here today?
I haven't had a history and physical for some time, so I wanted to have a history and physical, get some labs done.
Okay. Were you seeing a different provider before?
I haven't really seen a provider in the last 5 years other than the OBGYN.
Okay.
So I just thought it would be time. I'm a little bit older to get some lab work done.
How old are you?
34.
34. Okay. So the last time that you saw like a general practitioner was when you were before you turned 30?
Yes.
Okay, like 29
Mhm.
maybe. And you've been going to the OBGYN every year or every other year?
Annually.
Annually? Okay. Who is your OBGYN doctor?
I see Beth Rodriguez, the nurse practitioner,
Okay.
midwife, and I believe she's with Dr. Santiago.
Oh, okay. And do you get your PAP
My
done
PAP,
there
yes.
every year?
Every year.
Have you had any issues with that?
No, never had any issues.
Okay, so it's been a normal pap smear?
Yes.
Great. Okay.
I did have a uterine fibroid that they removed about 4 years ago.
Okay.
And it was benign.
Oh, okay. Okay. So what we're gonna do now is I'm just gonna get a bunch of information from you on your history,
Okay.
and then we'll go to the office before I do your physical. Okay.
Okay.
Did you have anything else that you wanted to address in this visit?
No, just to make sure my cholesterol's good.
Okay.
I don't have diabetes or anything like that.
Okay, great. Do you have any chronic health conditions, asthma?
I have
Seizures?
No, I have some seasonal allergies that I've had since a child, like allergic to dust, pollen, trees. That
Okay.
I'll take Claritin
Okay.
once a day for.
Okay.
And then I do have some acid reflux. It's better now, but a few years ago, I had an endoscopy and I had H. pylori. I was treated for that.
Okay. How's your blood pressure?
It's always been good.
Okay.
I never had an issue with blood pressure.
Okay. So for your medications, you take
Claritin.
Claritin. What else?
Zantac as needed, and I haven't needed it that often.
Okay. Do you take any other medications?
No.
Anything prescribed to you?
No.
Okay, so everything that you take is over the counter?
Yes.
Do you take any other over the counter medications?
No. Occasionally multivitamin, but I haven't even been good with that.
Okay. How about like Motrin or Tylenol?
I take Motrin for a headache, maybe once a month, every other month if I get a headache. Around the time I usually get my period,
Okay.
I'll take it for a day, just like once that day, and that's it.
And do you take any herbal supplements?
No.
Okay. And do you take the Claritin every day or just as needed?
I try and take it every day, because I do. If by the third day that I haven't taken it, my eyes will start to itch.
Okay.
And water.
And how about the Zantac?
No, that's only. I've pretty much modified my diet, and I know what triggers it. So I only take that if I eat something that I ate too much of, like say pizza or spaghetti sauce or
So
too
just
much
once
caffeine.
in a while.
Yeah.
How many times do you think you take it? Like, do you take it more than once a week or?
Oh no, not even, like once a month.
Once a month. Okay, so you sort of have it back under control.
Yes.
Okay, that's great. You live here in town?
I do live here in town.
Okay. Do you live in a house?
Yeah, my husband and I live in a house.
Okay.
Up in Rockland Key.
Do you live with anyone else besides your husband?
Our 2 daughters.
Okay. How old are your daughters?
10 and 7.
Keep you busy?
Yes, they do.
What grade are they in?
3rd and 1st.
Okay. Are they going to the same school?
They are. They do go to the same school.
Okay. And does anyone else live in the house with you?
No, just the rest of our pets.
Do you have a lot of pets?
We do. 2 dogs, a cat, and a bird.
How's that with your allergies?
Okay, actually.
Yeah.
Yeah. That's why another reason why I take Claritin every day.
Okay. Does the pet dander doesn't bother you at all?
Dogs never used to seem to bother me. Cats did, but we recently got a kitten, and the kitten hasn't been bothering me, but I think it's because years ago I didn't know I had allergies until I got tested, so I be around animals and I'd itch and
Okay, so you kind of got used to
yeah.
them. What else are you allergic to?
I'm allergic to 3 antibiotics: penicillin, Keflex, and erythromycin.
And then the seasonal allergies are
The grass, the trees, the pollen. After we moved down here, I did get allergy tested, and there's several types of grass down here that I'm allergic to, and trees.
okay. How about any foods?
No foods.
Any latex?
No.
Any other allergies at all?
No.
And how did you find out you're allergic to the penicillin?
I guess I was a child. I was about 5 years old, and my face got really swollen.
Okay. Have you ever taken it or any penicillin products since you were a child?
No.
Okay.
No.
What happened with the Keflex and the
I broke out in a rash with both of them.
with those two?
Mhm.
Have you taken any antibiotics that have been okay that you've been?
Yeah, I have taken Levaquin, Cipro, doxycycline, tetracycline.
Okay, and those were all fine
That
for you.
was fine. Yeah.
Okay. And then where did you come from before you moved down here?
Oh, I lived in New York.
New York. Okay. And now is your extended family down here?
No, right. It's my parents live in Sarasota, but my husband and I just live here. It's just him and I down here.
Okay. Do you have any support network to help with the kids or the pets or anything?
We have friends
Okay.
that help us. And my in-laws and my parents do come down, to help every, a couple of times a year.
Okay. Would you say that you have a lot of stress or anxiety?
Stress sometimes, with the kids and the day-to-day stuff.
Okay. What do you do to kind of cope with that?
I like to walk. We live on a canal. We try and take the kids canoeing.
Oh, that's fun.
Or take them out. I'll take them out so they can run around and burn off some energy. We'll walk around the block.
Okay. Would you say that you're pretty active?
Not as active as I should be, but yes.
Okay. Do you walk the dogs or?
Sometimes I walk my one dog is too old, but the little one I walk. She's not people friendly, but if I walk her at night when there's not a lot of people around, it's pretty good.
And on the canoeing and stuff is mostly on the weekends, or?
Yes.
Okay, that's fun. Do you have any other exercise that you do?
Other than the walking, no.
Okay.
Or canoeing, no.
What do you do for work?
I'm a registered nurse.
Okay, so that's a pretty active job.
Yeah. I mean, you're on your feet a lot. You do a lot of moving.
Do you work how many days a week?
Between 3 and 5. I work at the behavioral health unit.
Okay. How many hours a week would you say that you work?
Between 36 and 40.
Okay, that's good. And how would you say your health is?
I think it's pretty good up until this point. I don't feel sick or feel bad.
Okay. You feel like you're generally healthy?
Yeah, I feel like I'm.
Okay. How about your diet?
My diet, I mean, I pretty much eat 3 meals a day. I try and get enough vegetables in. I have salad for lunch. Don't eat a lot of bread and starchy, stuff. For dinner we always have like grilled chicken or fish, lean beef if we're gonna have beef, a vegetable. I think it's pretty healthy. I eat breakfast.
Okay. You do eat breakfast every day?
I do, yeah.
Okay, yeah, that's good. How about your sleep? How many hours a night do you sleep?
Anywhere between 7 and 8.
Okay, you try and always get that?
Yes.
That's good. Is it always possible, or?
I mean, sometimes on the weekends, no, because I'll stay up late to catch up on laundry or housework, or if I get involved in something, then I'm usually up earlier because it's my day off and the kids want to do stuff. So, but for the most part, I get about 7 or 8 hours of sleep.
Do you how much caffeine do you drink?
I drink either like 1 12-ounce cup of coffee or 2 8-ounce cups of coffee a day, depending if I'm at work or at home. I tend to drink more caffeine when I'm home.
Okay. How about soda, energy drinks?
I don't drink any soda or energy drinks. I drink a lot of water.
Okay, that's good. Are you a smoker?
No, I'm not a smoker.
Okay. Have you ever been?
No.
No? Okay. How much alcohol are you drinking each week?
I drink about a glass of wine, 1 to 2 glasses, 3 or 4 times a week. Mostly just 1 glass. That's like my soda.
Okay.
That's about it.
Okay.
I mean,
on the weekends, do you drink more?
No. No, because we don't really go out or do anything. We're home.
Yeah, with the
So,
kids.
with the kids, so no. No.
Did you ever say you would binge drink or?
I mean, when I was younger,
Yeah.
I would go out on the weekends and drink, but I always tended to be like the designated driver, so I didn't.
Okay.
I didn't.
Would you ever say it's been a problem for you?
No.
Okay.
No.
And how about any street drugs?
Never.
Never.
No.
Any pot or?
No.
No. Okay. Any prescription medications?
No.
Okay. And so as far as your health conditions, you mentioned that you had the GERD and allergies. Anything else at all, like asthma?
No asthma. No.
Any problems with your thyroid?
No.
Any problems, other problems with your stomach or?
No. No. I did have the GERD. I had to have an endoscopy a few years ago. I had H. pylori and was treated.
Okay.
And then I had to take protonics for a year.
Okay.
Until I got the diet situated.
Okay. And any recent weight loss or gain?
Weight gain.
Okay. How much?
Probably about 50 pounds over the last year.
Okay. Any reason that you can?
I just think I'm not as active as I was. I used to have a routine where I walked, almost every day, at least between 5 to 7 days a week. I would walk for an hour, and just with the kids in their schedule and work, it's been hectic to keep that routine.
Because you've been working more.
Yeah, and just the way we moved up the Keys, and I don't have the access to walk like I used to. I used to live in town, and I could cross the street and walk the beach, and that was, very convenient to home. The convenience isn't there.
Has there been any change in your diet, eating out more, or?
Maybe at some point there was, not now. I mean, I can't say like immediately right now. No, we pretty much eat at home, but I mean, there was a time where our schedules were so hectic that we were out. We weren't home with the kids' activities, that we would eat out more often.
And is there any other reason that you think you maybe gained weight?
No, I'm not that I'm aware of.
Okay. We can check your labs and just check if everything else is okay, if your thyroid's okay. You said you haven't had labs done in quite some time.
Yeah, about 5 years.
Okay, just rule out if there's any other medical reason. The walking is really good, but a lot of times we see with weight gain, it's a lot more about diet. So we can maybe have you do a food diary and just see, like, do some portion control stuff.
Okay.
And as far as chronic illnesses, have you ever taken any prescription medication in the past, like anything for over a month or?
I did take a few years ago. My husband and I went through some stress, and I took Lexapro for about a year.
Okay.
And then the Protonics I took for a year for the acid reflux. It was prescription.
Okay. The Lexapro is for depression? Okay. And have you had depression before that incident?
No, it's just a situation. I think it was just situational. It was just a lot of stress, losing the house, moving. The kids were little. We just had a lot of debt, medical debt, and it was just very overwhelming.
The medical debt was from?
My daughter, I was pregnant. I had preterm labor. I flew out to Miami in a helicopter, and then my husband had got an infection in his foot, and he had like a 3 to 4 day hospitalization. And then 6 weeks after my daughter was born, she was hospitalized for a fever. So it was just like a combination.
Wow.
It was all in 1 year.
Sounds really stressful.
It was. So, I was out of work for 6 months because I was put on bed rest. So it was just, we accumulated a lot of debt and stuff. And I mean, it all worked out. It's resolved.
How about now? Do you have depression?
No. We've since bought our house. Things are looking.
Okay.
Looking up.
Have you ever been hospitalized for any psychiatric illnesses or had any other diagnoses for psych disorders?
No.
Any suicide attempts in the past?
No.
Any thoughts of wanting to hurt yourself now?
No.
Okay. And When you were growing up as a child, did you have any illnesses?
Medical illnesses, I had constant strep throat, chronic ear infections. I had my tonsils and my adenoids removed,
Okay.
which I think now is related to I probably had a lot of allergies that triggered that. And
Okay.
it's under control since it's better controlled since those were removed.
Would you say that you were like a kind of a sick kid?
I was up until that till they removed my tonsils and took my adenoids out. Yeah, I was on antibiotics often. That's probably why I'm allergic to all
Okay.
three of those antibiotics.
What year did you get those removed?
1980.
Okay. And you were about like 5 years old then?
Yeah.
Okay. And so after that, your health got better?
Yes.
Okay. And so you had a tonsillectomy, an adenoidectomy, you had some preterm childbirth. Have you had any other major surgeries?
No.
Okay. And have you ever been hospitalized for any other reasons?
Other than childbirth, no.
Okay. And your first childbirth was a regular vaginal birth?
They both were, yes.
They both were. Okay. Any other problems with like your OB? Do you get a mammogram?
Yeah, I'm due for a mammogram.
Okay. You haven't gotten one yet?
No, I had one a few years ago because I had felt a lump, but I haven't had one since then.
Okay. And so you're doing regular breast exams?
Yes.
Okay. And what happened with the lump?
No, they didn't see anything.
Okay.
There was nothing. It was probably just a cyst.
Okay.
You know, like one of those cysts that come and go. I've been told I've had like what is that, cystic breast? That's triggered, comes and goes with caffeine.
Like fibrous breast?
Yeah, yes.
Oh, okay. Okay, with caffeine.
Yeah. So I mean that's why I try. I probably still drink too much than I should, but
do you have you ever had any positive STDs?
No.
You've been tested for HIV, hepatitis?
When I was pregnant, yes.
Okay. You were tested for
Mm-hmm.
Okay. And have you before you were married, were you having sex with high risk partners?
No.
And have you had more than one partner since you've been married?
No.
No. How would you describe your sex life?
I think it's pretty good.
Okay. Any problems?
No problems.
Okay.
No issues.
Okay.
With that.
Okay, great. Just have to talk about your family.
Okay.
I'm going to do a little genome here. Just want to genogram. I'm sorry. Ask you about any family history of illnesses. So we'll start with like your mom and your dad.
My mom is currently being treated for, I guess, high blood pressure.
Okay.
And my dad never had high blood pressure, but when he was, let's see, he's 70, so about 13 years ago, he always had a heart murmur, and so I guess his aortic valve had vegetation on it. He went and had his aortic valve replaced, and he also had a thoracic aneurysm fixed at the same time. And
Okay.
since then,
when was that?
It's about 13 years ago.
Okay. And so,
I mean, other than that,
how's his health now?
it's fine. I mean,
Does he have hypertension? Or?
They just have him on medication, hypertensive medication. I don't necessarily know that it's for treating hypertension. I just think it's management of the valve. He's on Coumadin.
Okay.
And low pressure.
Okay. And does either of them have diabetes or
No.
seizures, asthma?
No.
Okay.
Both of them do smoke, but
they're smokers. Okay. Does your husband smoke or any smoke in your house?
No.
Okay. And now, how about, and they don't have any other chronic conditions that you know of or take medicine for?
No.
How about your, do you have sisters and brothers?
I have a younger sister.
Does she have any medical problems?
When she was a child, she had seizures.
Childhood seizures?
Yeah.
And now, do any of them have any mental health problems?
No.
How about any alcohol or drug problems?
No.
Okay. And now, how about your grandparents? We'll start with like your mom's mom and dad.
My mom's mom had blood pressure, and she got diagnosed with type 2 diabetes when she was like 78 years old.
Okay. Okay. So maybe like diet related?
Yes.
Okay. Gained weight?
Gained weight, yeah.
Okay.
My mom's dad, he had rheumatic fever as a child, so he had heart disease with congestive heart failure, cardiomyopathy, um, for a good part of his life.
Okay. And they're both still alive?
No, they're deceased.
Okay. How old were they when they passed?
My grandmother was 80 and my grandfather was 82.
Okay. And now, how about your dad's parents?
My dad's dad is 100.
Wow.
Yeah, he did have some heart disease. He had some stents placed probably about 20 or 30 years ago. He had open heart surgery, and he has high blood pressure, no diabetes.
Okay.
He was pretty active.
And your mom, I'm sorry, your dad's mom?
She's 95. She just has blood pressure.
They're nice and healthy.
Yes.
Okay. And anybody have cancer in your family?
My mother's sister had breast cancer.
Your mom's sister. Okay. Any other major mental illnesses, like any MS or any Parkinson's
No.
or anything like that?
No.
Okay. And no mental health problems?
No.
Anybody with drinking problems?
No drinking. My mom's mom did have postpartum depression.
Okay.
After her second child.
Any family history of suicide?
No.
Okay. And are your girls, are they healthy?
Yes, they're healthy.
Any issues at all?
No.
Okay. You said that the one got admitted to the hospital for, was it a fever?
It was a fever.
Okay.
That they had, it wasn't, they thought maybe meningitis, but her fever broke after 24 hours.
So it wasn't that. Okay, that's great. Did you, when you were a kid, did you get your immunizations?
I did.
Okay. And then have you had your adult boosters?
I know when I graduated high school going into college, I had to get the hepatitis. I'm sure I've had tetanus. Probably my last tetanus shot's been over 10 years.
Okay.
But yeah, I always got my tetanus, my measles, mumps, rubella.
Okay. And now working as a nurse, you probably have a TB test.
Yes.
And your hepatitis B.
Yes.
Okay. And that would be like probably at the hospital.
Yes.
Records. Okay. How are you about like checking your blood pressure and doing like regular screenings, things like that?
Probably not as good as I should be. I mean, I know when I go to the OBGYN, they check it. It's never been.
You haven't really ever run high or anything like that? Have you checked since you've gained weight?
I have, and
Okay.
it's still, I mean, I normally ran like 90 to 100 over 70 to 80. I'm like 120 over 80, 130 over 80.
So still pretty good.
Yeah.
We'll check it today. I was just wondering about the history.
Yeah.
And then have you had any major accidents, like car accidents, head injuries, loss of consciousness, anything like that? Okay. Never. So it sounds like you're pretty healthy. So just the main concerns are that you've put on some weight, and you wanted to check your labs and make sure everything's normal there. You said you've never had a abnormal lab, like high liver enzymes, high cholesterol, nothing like that. And the last time, that was about 5 years ago that you checked. Okay, so it's a good time to check again. We'll run full panels. And I think that's it. You have insurance, correct?
Yes, I do.
Any financial difficulties?
No, not at this time.
Okay, you and your husband's working?
Yeah, he's a teacher.
Okay, so you both have pretty steady, good jobs, and
yeah, we have a steady income.
Nothing else that you're concerned about at this time?
No.
All right. So we're gonna have you go change, and I will show you the exam room.
Okay, great.